Hello, thank you for choosing to listen to this webinar, the title of which is My Cat is Sneezing. My name's Sarah Caney and I am a RCVS specialist in feline medicine based in the UK. If you would like a PDF copy of the slides I use in this presentation, or if you have questions, you're welcome to email me at the address shown on this slide. I have no conflicts of interest to disclose that are relevant to this presentation. So the starting point for us as clinicians presented with cats reported to be sneezing is to try and recall as best as possible what are the major differential diagnoses that we need to consider. And I've put what I consider to be major differential diagnoses subdivided into acute and chronic causes of sneezing in cats on this slide. So we can see, unsurprisingly, for example, in the acute scenarios, we have examples like infectious diseases, cat flu, essentially herpes and Kalichi's virus primarily, but other infectious agents also can cause some upper respiratory tract signs, things like mycoplasma, for example. We also have the possibility of a foreign body, and very common example, which I know you'll all have seen, would be a bit of grass that the cat may have eaten, and then perhaps it threw up or coughed up. A bit of that grass went to the back of the nose, and that's now causing this sneezing and upper respiratory tract signs. And possibly trauma as another possible cause of sneezing in cats, potentially the cat that has a road traffic accident, for example, and damage to the face. Chronic upper respiratory tract disease is also quite a common phenomenon in our clinics, and examples of that shown on the right hand side. So we have, for example, the possibility of nasal neoplasia, chronic rhinitis, allergic rhinitis potentially, nasopharyngeal polyps. So these are polyps that typically arise in the middle ear and then travel down the eustachian tube to sit in the nasopharynx and can get quite large and still be reasonably well tolerated, but sneezing, nasal discharge, some gagging and retching seen in association with those, and also sometimes they will grow also up the ear, external ear canal. So that is going to be a clue that we might get in our physical examination later on in this lecture. Nasopharyngeal stenosis would be another possibility. Typically that arises post-inflammatory disease, so following cat flu, for example, where fibrosis, scar tissue can actually cause a narrowing at the back of the nose, where the nose empties into the pharynx and beyond. And of course we'll have other possibilities like tooth root abscesses, for example, that could cause a nasal discharge and potentially some sneezing. So a number of different possibilities for us to consider. And the first step, of course, when our patient is presented is to take as detailed and thorough a history as we possibly can to get as many clues as we possibly can that are going to help us to perhaps cross off some of these possibilities. So, for example, an acute onset is more likely to be associated with a foreign body, a gradual chronic insidious progression more likely with a tumour, and of course other features between the two in terms of the other differential diagnoses that I mentioned in the previous slide. Also important to consider how long has this been going on for, because that will affect our likely differentials. For example, if the cat has had sneezing and nasal discharge for several years, it's probably not a tumour. Something like chronic rhinitis would be much more likely. Equally, something that's been going on that long term is unlikely to be a simple infectious disease that is causing it. If the infectious disease has an impact, it's likely through causing permanent damage to the nasal turbinates, which is typically what happens in those chronic rhinitis cases where following that viral infection and bacterial colonization results in permanent damage to the nasal structures, leaving them very vulnerable to repeat infections and therefore persistence and recurrence of clinical signs. Whether it's uni or bilateral, of course, be another clue. So, for example, foreign bodies and tumours would tend to be unilateral, at least initially. And then progression. Again, with a tumour, we would expect the clinical signs to get worse with time and for there to be a relatively short period of time over which those signs occur. So, again, not a history lasting several years. And then last on this slide, I've put response to treatment, and that of course can give us very helpful clues as well. And an example of that would be, again, with the chronic rhinitis cases. Often it's that bacterial infection that causes the nasal discharge. So chronic rhinitis patients, typically the nasal discharge clears up, it responds 100% or very close to 100% to a course of antibiotics. The problem is that when the cat is off antibiotics, it's very vulnerable to recurrence of those clinical signs. In contrast, a tumour is unlikely to clear up with antibiotics. So all of these things are going to give us a clue, and then we move on, of course, to our physical examination, the next part of our patient assessment. And in some situations, even standing at a bit of a distance from the cat, we can get some really vital clues. And I've put some really obvious examples on this slide where talking to the owner, listening to their history, even just glancing at the cat is going to be giving us some vital clues. For example, the head tilt related to the cat's ear disease, the origin of the polyp causing some vestibular signs in this cat. We've got a severely brachycephalic cat, so if the cat's presented with upper respiratory tract signs, it's going to be quite possible to explain through that congenital formation of the cat as certainly a factor. We've got some examples of neoplasia as well. Sometimes that can be superficially obvious, such as that the cat, the tortoiseshell cat, you may, I think, just about be able to appreciate she's a tortoiseshell in this photo where she has squamous cell carcinoma affecting her external nares. The Siamese cat below her actually is one where we can't see the tumour, but we can see there is something asymmetrical about this cat's face in that the pigmentation is very different, and this is quite an interesting phenomenon whereby in our colour point cats, like the Siamese cats, the darker coloured extremities are as a result of temperature sensitive changes. And so what we're seeing here is that the cat, one side of the face looks darker than the other, or perhaps the abnormal is the paler side, and it's paler because the tissue underneath is warmer, and it's warmer underneath because there is more active tissue there, and in fact in this case that was nasal lymphoma. But just looking at the cat actually gave us a clue that there was something going on in that vicinity of the cat that was affecting the pigmentation. And then lastly, we have the cat with nasal involvement, which is bilateral, but also some ocular involvement. You can see the eye looks very abnormal, and that immediately tells us that something is likely to be going on that's involving not only the nose, but also the orbital area as well, resulting in that abnormal appearance to the eye. So that would raise neoplasia very much higher up the list. We're not going to be thinking that cat flu is a likely possibility if temporarily the abnormalities with the nose and the eye appear to be linked, and in this situation that was in fact the case. So we had a nasal carcinoma. So after we've done our full history, our full examination, then of course we want to write a problem list and come up with some suggested differential diagnoses that allow us to then make a diagnostic plan. And there are a number of different options that we can consider when it comes to diagnosis of sneezing in cats. And to start with, I've just put our general blood profiles on here because this is often something that we include in really any investigations of a sick cat. But perhaps unsurprisingly, our routine haematology, biochemistry and even virus screening, thinking here of blood tests, so FeLV, FIV, is probably not going to give us the answer in terms of why the cat is sneezing. But it may still be helpful. It may be helpful particularly if we have a sick cat that we're worried about. Is this cat dehydrated? Do they have concurrent illnesses that may or may not link with the nasal disease? And in particular, if we're thinking about neoplasia, then we may wish to screen for retroviruses because we know cats with retroviral infections are more vulnerable to tumour formation. But overall, as I've said, unsurprisingly, our blood tests are unlikely to give us a useful answer. We next have the possibility of infectious disease swabs, so swabs for PCR testing for upper respiratory tract infectious causes of sneezing. Examples like herpes and calicivirus I've already mentioned, but also chlamydia, chlamydophila, typically causes more ocular dominant signs, but in some cats can cause sneezing. Mycoplasma, of course, secondary bacterial problems as well can be an issue here too. And in terms of the significance of doing infectious disease testing, it really does depend a bit on our patient and their background as to whether this is, I think, a justifiable thing to do. For acute scenarios, and in particular multi-cat scenarios, perhaps the rescue shelter, the breeding cattery, or a household where perhaps cats are coming in and out, as in new cats being added to the household, or the household being changed, then this may be really important for us to understand what has caused those acute upper respiratory tract signs. But perhaps in a single cat household where the cat has typical signs of cat flu, of course, it may not always be clinically justifiable or necessary to actually confirm that by doing our viral swab. We may be happy to make a presumptive diagnosis and manage that cat accordingly, and that is absolutely fine. For many of our patients, particularly the chronic cases now, if we want to try and understand what's caused their sneezing, we're going to next need to consider options that involve anaesthesia of the patient and allow us to examine the patient in more detail, to look more thoroughly at the mouth, the pharynx, the back of the mouth, the larynx as well, potentially looking down the ears, thinking of those polyp cases, potentially doing rhinoscopy, looking into the nose, endoscopy, looking at the back of the nose, and potentially also, of course, imaging, radiography and CT, for example, are all possibilities. And then depending again on what differentials we're considering, there may be things that we see that we're concerned about and decide to biopsy, or suspicions that we have that lead us to wish to do that as part of our investigations, or we may be lucky and see that bit of grass and be able to grab that and pull that out. And so the outcome essentially is going to vary according to what we find, but we've got this sort of spectrum of things to consider. Radiography, I think, still can be really helpful for investigating upper respiratory tract cases. The sorts of views that can be helpful listed on this slide, and I'll show some examples of nasal and pharyngeal radiography in just a moment. Certainly if we are either concerned or diagnose a polyp, then looking at the ears as well, looking at the bullae, can be indicated as part of our investigations. And for some of our respiratory cases, chest x-rays can be indicated, whether that's because of a tumour and we're looking to see if there's evidence of spread, but also some other things, that can affect the chest. For example, some herpes cases can cause pneumonia and tracheal edema. So there are situations where expanding our radiographic study to involve the lower respiratory tract is actually helpful, even if the patient's primary clinical signs are upper respiratory. So I showed you this cat, Gemma, earlier on, Gemma, the Siamese cat, where you can see the asymmetrical appearance due to the altered pigmentation in her face. And as I said, the ears, the face of Siamese, if they are seal point as she is, are darker in colour because they are a cooler temperature. And yet you can see one side of her face, the right side of her face, is actually paler. So it's the skin underneath there is warmer, and in her case she did present with nasal discharge and some upper respiratory tract signs. And when we performed our investigations, this is her intraoral occlusal view, radiograph view using non-screen film. You can see that one side of the nose is very soft tissue density compared to the other more normal appearing side of the nose, and I've included a normal radiograph for comparison there, which hopefully makes that obvious as well. And on biopsy that was nasal lymphoma, so that was the cause of her physical appearance externally, and obviously her clinical signs that were reported by her owner. The lateral pharynx view also I find can be quite helpful in these sorts of cases. Having a little foam wedge to lift the jaw so that it is as horizontal overall and superimposed as lovely as this view is ideal, and then you will be able to see between the teeth, the soft palate just at the caudal edge of the mouth, and there is air above there and air below, so air in the nasopharynx and air in the mouth, and that contrasts to the next image where we can see it generally is very, very white, but the pharynx is completely full of white due to an absolutely gigantic nasopharyngeal polyp. We really didn't actually need to take this view to make that diagnosis, but it's good from a teaching perspective. And if I help you a little bit by outlining where that polyp is with the dotted lines just now, you can see again absolutely gigantic polyp in her, which was completely occupying her nasopharynx and caudal pharynx there. Examining the nasopharynx is something that can be done, I think is very straightforward to do with really low-tech equipment. And so if you're thinking, well, we don't have a good endoscope to retroflex and look in cats' nasopharynxes, therefore what can we do? This is a really helpful technique that I would always do, even if I do have an endoscope available to look at the cat's pharynx in that way. So to examine the nasopharynx, you want your cat to be anaesthetized, and I prefer the cat to be lying on their back. So this cat is lying on their back. The ET tube is going over the cat's tongue at the top of the picture, and then I put a little bit of local anaesthetic as per pre-intubation just on the edge of that soft palate, which you can see in the circle, and that's the bit that I then will grasp with some forceps and pull rostrally, so pull towards the cat's nose, and then you can look underneath the soft palate. That is the intention of the procedure here. So another picture now, and this cat, it's orientated so the nose is on the left of the picture, the tongue being pulled over the lower jaw is on the right hand side. The tissue forceps are pulling that soft palate towards the nose, and then you can see below there that there is what looks like a smooth opening to the back of the nose, and it's a very collapsible sort of openings. But if you have a laryngoscope, which is also a great piece of kit to have available to you, you can examine that area, and what you'll find is that when you put the tip of the laryngoscope into that opening, it's very distensible in a normal cat. So it just opens up, it's very wide open. And it's useful to do that and to know what's normal for those situations where you might see an abnormality. And the first abnormality you might see when you actually pull that soft palate forward is a polyp. And if it's a large polyp, you'll probably already be suspicious of that, because intubation is going to be a lot harder. If that soft palate is depressed by a polyp, it can actually really obscure your view of the larynx. But smaller polyps obviously can hide a little bit away. And then if you do have a polyp, you can grasp it and just gently remove it by traction through the mouth. Looking up the nose can be helpful, and of course it's a tiny area to get any equipment up, but a rigid arthroscope is a useful piece of equipment that can be helpful in this situation, but don't have your hopes too high really, because of the limited size of a nostril, you can get the arthroscope up, but you can't really get flushing or biopsy equipment alongside it. So very quickly you'll find your view typically is obscured by a little bit of mucus, or perhaps a bit of blood if the tissue is very friable. But in a healthy cat, actually you will get a really nice view of the turbinates, and you can sort of slide between them and get a nice view of the nose. So for some cats with foreign bodies, you will actually see that foreign body. You might not be able to actually grasp it with anything alongside, but you at least know what you're dealing with and can try and flush that through. The other option, of course, if you have available to you, is an endoscope that will retroflex and curve back on itself, and that you can hook around the soft palate and look back to the back of the nose, the choane. And what you might see, again, might include a foreign body, perhaps surrounded with some mucus, which is actually what was present in that middle picture there, although hard to appreciate, I can understand. Or you might see a mass, which may, of course, be a tumour or inflammatory tissue, and the endoscope as well is likely to afford you the option of actually biopsying that as well, and just make sure you put the biopsy forceps down the scope before you send it on its curvature, so that you're not forcing your biopsy forceps to go down a sort of curving endoscope, which can cause damage. Taking a nasal biopsy is also something that can be very helpful in these sorts of cases, and in general terms you're often forced to take a blind biopsy because of the limitations of what you can put up a cat's nose simultaneously. And there are a number of different techniques that you can use to collect nasal tissue. In general, I would say endoscopic biopsy forceps, if you have them, work quite well. Examples like the one shown in the picture here. And what I will typically do is, particularly if I'm suspicious of diffuse disease, whether it's both sides or just one side from my radiographic investigations, is that I will gently open the forceps, introduce them through the cat's nostril, and then push them against the nasal tissue to get a biopsy. And before I insert the biopsy forceps into the cat's nostril, I will actually measure the distance from the nostril to the eye on the other side, and just make sure that I hold the biopsy forceps at that point, so I don't go too far and risk the possibility of, particularly in a cat that has damage to their cribriform plate related to their nasal disease, you could in some situations essentially end up taking a brain biopsy, which clearly you don't want to do. So make sure you just know how far your forceps are in, and therefore you're a safe distance, and this is reckoned to be a safe distance. And often I would say in cats that have significant nasal disease, you'll get really nice chunky biopsies. But if the cat doesn't really have much going on, for example, it has some chronic rhinitis or mild rhinitis, you often will find you get frustratingly tiny, annoying little biopsy fragments. So if you get a really chunky biopsy, that's brilliant, but do what you can, and hopefully you'll get something diagnostic back from the lab. You can also, in some situations, get biopsies using the techniques that I've put on here. So a needleless syringe aspirate can, if you've got very friable tissue, sometimes yield you some useful results, and catheter suction biopsies as well. So if you don't have endoscopic biopsy forceps available, you can try these alternative techniques to try and get some tissue. And again, I would say the same principles apply, in that relatively healthy nose, you're not likely to get much back. Very abnormal nose, you're likely to get diagnostic samples. And then a last option, I think, is nasal flushes. From a flushing for cytology perspective, I don't find terribly helpful, but often you can get poorly representative samples, as in lots of tumours have inflammation around them and you may just see inflammatory cells. But the situation that can be rather more helpful in some cases is where you're actually using what's called a forced nasal flush to try and dislodge tissue that you can then analyse. And so I've written the technique, summarised the technique for that on this slide. And so the intention very much is to inject under pressure a relatively large volume of saline into a nostril whilst occluding both nostrils, in the hope that you can just dislodge a friable bit of either tumour or granuloma or foreign body and out of the back of the nose. So of course important to use a nice fitting ET tube, to put some swabs around the larynx and proximal esophagus to really absorb that fluid coming through. And if you do have forceps attached to the soft palate and bring that forward, have a swab below there as well to try and catch what comes through, then sometimes you are lucky and you will get a lump of tissue, and that's absolutely brilliant. And this other technique I put at the bottom of milking the pterygoid fossa can be helpful again to dislodge tissue if you have got granulomatous or neoplastic processes going on. And that essentially involves massaging the hard palate, going from nose caudally to try and again encourage things to dislodge. So the intention, of course, of all these investigations is to reach a conclusive diagnosis, and that's going to be the best way to find the solution that is best suited to managing the cat's condition. And I hope this short presentation has given you some tips on what to look out from a history and physical exam perspective that will help you achieve that aim. I will refer you also to other resources that are available on my website, and there are owner-facing resources, a number of webinars, for example, as well as veterinary professional-facing resources, which I hope you might find helpful. I am a consultant for virtual veterinary specialists, which is why I've also put their logo on the slide. And as mentioned at the start, if you would like a copy of lecture slides used, or you have any questions, please do feel free to get in touch with me via email. Thank you very much for listening.